and welcome to Population Health Plugin, a show highlighting current public health topics in our community and things of interest to students across the university. My name is Meena Nabavi, and I'm a program manager in the Office of Public Health Practice at the University of Alabama at Birmingham's School of Public Health. Today, we are joined by Miss Stacie June Shelton. Ms. Shelton is the global head of education and advocacy for the Dove Self-Esteem Project, which is a set of programs and interventions designed to develop and increase body confidence and self-esteem in young people around the world. Ms. Shelton has more than 20 years of experience in public health research, program and partnership development, and project management. She is also an alumna of the UAB School of Public Health and has her MPH in health behavior. She currently resides in Bristol, United Kingdom. Ms. Shelton joined us earlier today for a career conversation seminar, but we wanted to invite her back to do a podcast to learn more about what she's been working on since leaving the School of Public Health. And for full disclosure for our listeners, I actually met Ms. Shelton on LinkedIn. So I am part of the Exploring Population Health Study Abroad course. And when we were planning to visit the UK in summer of 2020, I wanted to see if we had any alumni in the London area that our students could possibly meet with and network with. I messaged Ms. Shelton and we started a conversation about her work with Dove and Unilever. But unfortunately, COVID changed our plans for 2020 and 2021, so we've been unable to meet in person. But given this unique opportunity, while everything in the world is virtual, we wanted to invite Ms. Shelton back to the School of Public Health, virtually of course, to talk about her work. So thank you, Ms. Shelton, for being here today and taking time out of your busy schedule and dealing with the time difference too, to talk with me. We really appreciate you being here today. Start off by telling us a little bit about what you've been up to since you've graduated from the School of Public Health. I know you currently work at Unilever and with Dove. Can you share more about the projects that you oversee?
Hi, Meena. Yes, thanks for having me on the podcast. Very happy to share kind of my career journey and what I'm doing now, how I got there. So yes, I when I left the School of Public Health, I ended up moving to Oregon, and I lived in Portland, and I started working for the Oregon State Department of Health. And I got into physical activity promotion and the adolescent health section. I was working in a coordinated school health program across the Department of Health with the Department of Education in Oregon. It was a CDC funded project. So that was my first, state level experience and kind of really getting into policy and programming within the state government setting. And then I decided, this is great and all, but I'd always had this interest and kind of adventurous spirit for international health. And I hadn't been one of the students that had focused on international health or had done Peace Corps. But I thought, you know what, I still want to give this a try. And I was really encouraged even by, my colleagues and friends to pursue that. So yeah, I went to India and was able to find some work experience actually with one of my classmates from UAB School of Public Health, Sanjana Bhardwaj. And she was working with UNICEF, and she and her husband had started a health foundation in Mumbai. And so that was great. That gave me that hands-on experience I needed in international health, just to understand the context and the setting and the cultural differences and, being an American, living abroad. So that was incredible. I worked with them for a few months, just getting, various project experience, and then was able to join Population Services International in Mumbai office. And we were working on HIV/AIDS prevention projects with voluntary counseling and testing centers and vans, as well as some work with truckers and commercial sex workers in India. I loved it, but I really wanted to get back to my kind of adolescent health and school health roots and interests. I had done some teaching as well, and training as a health education teacher, and I came through health behavior. So I wanted to work with that adolescent age group. I started working with a local nonprofit organization in India, and they have rural schools. They call them ashram shalas, and they were for like tribal children, Advocacy children, in rural India. And India is such an incredibly diverse place and such differences between urban and rural. And that just started adding to that work experience I needed. And then it was in India, I joined Unilever. And that's been an incredible journey for the last 10 years, working for Unilever, 5 years on a wash program with one of the brands, Lifebuoy, across Asia, Latin America, Africa, but based in the global team out of Mumbai. And then I now work on Dove, on still in Unilever, but now the global Dove team. I'm based out of the London office. So yeah, that's public health journey that got me to where I am today.
Before I ask my next question, I just want to comment, the importance of networking. Like you said, that first opportunity in India was from connections that you had maintained from the UAB School of Public Health from another alum of the school. So, just again, highlighting for those listeners the importance of keeping in touch and networking. So, I love that story. To get back to what you're doing with Dove. So, what do you do as the global head of education and advocacy for the Dove Self-Esteem Project? What sorts of job duties and responsibilities does that entail?
So I'll try to keep it compact. I end up doing a lot of everything sometimes, but my elevator speech version is that I'm responsible for developing interventions, so body confidence, self-esteem interventions for adolescents. I manage the partnerships where we're developing those or else implementing the programs. And then more in the past couple of years, doing a lot more advocacy work, whether that's global advocacy or even local policy change and legislation.
So, can you talk about kind of what made you interested in that and first job with Unilever? You were previously working for PSI and that nonprofit work, but what about Unilever kind of attracted you? And what do you enjoy most about working with them?
I have to admit that I was quite skeptical initially, like, could the private sector actually do real public health work? Again, networking, super important. So I had a friend who worked, public health social circle within Mumbai, and had a friend that worked at Unilever. And so I knew of her work. I knew she had, done her doctor of public health from London School of Hygiene Tropical Medicine. So I was looking for roles in Africa, and because I felt like I'd had a lot of time in India, I needed to go live and work in Africa. And she, said, well, listen, I need someone to work on school and then adolescent health programs we have around hand washing behavior change. Would you do this? So she sent me the material, and it just was so impressive. They had used, all the behavior change theory we learned in school, but then had, with the private sector's access to creative agencies in terms of, if you look at social marketing and behavior change and communication materials, it was just the top. It was incredible. It was packaged up, concise messaging. So yeah, I thought, well, I'll give it a try. So I thought I would do it for a year and just see how it was. And then 5 years later, on Lifebuoy, after moving around and managing some projects in Africa, I did finally get to go to Africa with Lifebuoy, and was based in Nigeria and Kenya. It was definitely not planned, but it's been an incredible journey. What I love about it is because it is fast moving. We're doing a lot. We have long-term plans and strategy, but then we're agile and reactive to what's going on. Especially in my current role, where there's a lot around pressures from the media on appearance ideals and self-esteem and body image, and it's working with so many different really creative minds. By the time I can get, the academically kind of evidence-based messaging, and then we package it up into really creative films or, different assets, static assets. By the time you get the agency to kind of package it up, the beautiful imagery, it's just so eye-catching, and in the reach that we have with our brands and the ability to combine, there needs to be a business case to it, absolutely. And with Lifebuoy, the more hand washing occasions we could get people to increase, not only would you reduce diarrheal and disease and pneumonia and reduce under five child mortality, but we knew there was a business case to increasing hand washing with soap behavior change because you could have an increase in soap sales. There's this constant challenge, to kind of be the best, do the best, stay top of mind for our program recipients. And we get to be involved with the latest innovations, talking. I have partnerships with Facebook and Instagram and Cartoon Network. So yeah, I think it's just the access to so many amazing creative people and agencies and businesses and partners that's really appealing.
A lot of our students, like you, were, maybe skeptical of or may not even think about joining the private sector. So I love that story. And you've been in several different areas, working in governmental public health, nonprofit, and now for-profit private industry. So that's wonderful. So I want to kind of switch gears a little bit and go back to when you were here in the UAB School of Public Health. So you graduated with your MPH in health behavior. Why did you choose public health for your graduate degree?
When I finally discovered what public health really was, it certainly wasn't top of mind when I was an undergrad, unfortunately, but a friend was applying to a public health school and she wanted me to read her essay. And so that's actually when I discovered public health. My undergrad had been health and sports sciences, so I was always interested in health promotion and to really be able to dig in deep to the psychology side of changing health behaviors. It was a perfect link to what I had, my interest and purpose, and what I had already studied as an undergraduate, and just understanding, to take it so wide, take it to the public. I wasn't interested so much in medicine or clinical care as much as kind of that more public health, widespread health promotion campaigns and behavior change.
Were there any experiences or opportunities at the UAB School of Public Health that prepared you for your career?
Yeah, so many. I know you sent me the questions in advance, so I did have some time to think about it, which is great to reflect back that many years ago. Based on my learning style, I'm a very hands-on person. So the access, like I had a role as a research assistant on a project. We were working with community health advisors in like Southern Alabama, and it was just that hands-on experience of running the trainings, and then conducting the research was just incredible. So having the access, I think, to the sorts of research assistant jobs and things, and then any of those, I think in my evaluation class it was, we had a real group work and hands-on, going and evaluating some of the local public health programs there in Birmingham. And then other, case study work, I recall that was really helpful. I think what I'm finding across the board anywhere, whether it was in the government role or in the nonprofit sector, now in private sector, is you have to be able to work across multidisciplinary teams. And so that was really great in that course where, we were bringing together all of the students from different functions of public health, and we were working together on a single project. So again, super hands-on, but I think that multidisciplinary work across the board. And then, all the behavior change theory was critical now to me, being able to develop any programs and strategy, and then the research we do as well. The theoretical piece was very helpful.
So you've kind of segued into the follow-up question about
Okay.
how these experiences in the education kind of how you're using them in your current job. How those skills really benefit you in your current position or even past positions as well.
Yeah, like I said, just I mean, being able to work in teams, and work across that's something I face every day. And having, especially now in the private sector where I don't actually work with anyone else in public health on this particular team I'm on now, constantly working in multidisciplinary teams, is really strong.
I'm so glad that you mentioned, working in teams because that's something that I think is important for our students and our graduates when they enter the workforce, knowing that, we don't work in our own silo by ourselves in order to be successful in whatever field of public health, right? It's going to require collaboration and working with people outside of public health, just like you said.
Absolutely. Yeah. Even in government agency too, that was critical because you start to work in silos. So I would start to work in a silo on physical activity, nutrition, but then, yeah, I need to communicate across, especially agency wise, the communication between public health and education. That is a difficult relationship to manage. I've seen that globally as well. You just, getting ministries of health and ministries of education to agree on something is really hard. So yeah, taking the time to do that communication, interpersonal relationships is critical skill to have with any of the partnerships I'm developing at an individual level. We are human beings, and so you have to have really good interpersonal skills for that.
Well, how has your work experience differed from what you imagined it would be from, graduating fresh out of graduate school with an MPH? How has it differed from what you thought working in the field of public health would be?
I mean, I think just the private sector route was definitely not something I ever imagined. I'm still like when my work at Population Service PSI, they bring in a lot of private sector executives and communication creative agency experts. So in social marketing, in terms of that's what I'm doing now, social marketing, that's still the same, but I never imagined doing it in the private sector. I think Unilever, stands out in terms of being kind of a fast moving consumer goods company that is doing this type of work. But the consumers are demanding that more and more businesses and brands are. So I think that's only going to grow. And yeah, I imagine myself probably working with a big team of public health professionals, like I was at the government level, but that's completely different. Now, like I said, I'm working with like a really multidisciplinary team, agencies. I do work with academics. I do work with public health partners. We work with UNICEF and Plan International. So I am working with them, but my teams and network has grown.
So, in your opinion, what can students do while they're in school to prepare them to enter the workforce and start their careers?
Yeah, I mean, like you said at the start, networking. I mean, I wouldn't have gotten my first international health opportunity unless, I had been friends with Sanjana, and then just kept in touch. So yeah, that networking is really important and just learning from each other because we come from different places and have different experiences. So I was networking with her out of a really authentic space that she and her family were just interesting people. So networking and yeah, the experience, find opportunities to get experience. There's such great research projects going on at UAB across the board. Even if it's maybe not in an area that you're super passionate about, I think a lot of those skills are transferable across whatever topics, you're working on. So just getting that hands-on experience and like me going to rural Alabama, some of these trainings and projects and community engagement, that was so critical to my international health work even. So yeah, networking, getting that real hands-on experience where you can either in the coursework and courses that offer that up or in projects.
And I love that you said it's okay if it's not in what you think, the area that you think you want to go into, just that experience can be transferable across different
Exactly.
areas.
Yeah.
So for students who are looking to work with the private sector, possibly Unilever or other companies, do you have any advice for them?
Yeah, I mean, be open-minded. Be open-minded because, like I said, people, they have different ways. They've been trained, either as MBAs or, marketing executives or creatives or graphic designers. So I think, be super open-minded, listening, and be ready for the fast pace. It's a different pace definitely than like the government pace, or even at kind of the NGO sector level. It's been a great journey. I definitely didn't think I would be here, but I think it's helped me grow a lot and kind of get outside my comfort zone. Still, daily, I have moments where like, oh, this is awkward, or I don't feel like I'm skilled enough in this space. But I've learned how to buy media on the job. You learn a lot of these things on the job, or there's enough people and training within in the workplace. So yeah, I think be super open-minded about what you could do.
So, one last question for students who want to learn more about the work that you do with the Dove Self Esteem Project, where should they go for that information?
Okay, great. I get to promo my project.
Of course.
Thank you. Yeah, dove.com / self-esteem. It will geolocate to your local country website. And yeah, it has everything we do. We have like platforms for the teacher tools, youth leader tools, parent tools. You can see a lot of our communication campaigns. You can also follow on Instagram, the Dove handle. You'll get some product promos too, but we probably weekly there's some updates about the Dove Self Esteem Project, and what's going on with our partners there. So yeah,
Have been on the website and there are lots of resources. So our listeners should
yeah.
definitely check it out. So, well, thank you so much for being here and answering these questions for me and sharing your story with our listeners. I really do appreciate it.
Thanks, Meena. Yeah, anytime. I enjoyed talking about myself. All
Wonderful. Well, and
right.
thank you for listening. Please tune in next time for another episode of Population Health Plugin.